health education. A nurse teaching patients how to monitor their blood sugar, count or measure their carbohydrates, and inject insulin properly is a form of health education. Um, Taking a school lesson, maybe secondary school students on smoking, that is a form of health education. Explaining the health risks of tobacco, addiction, and so on is a form of health education. Nutrition workshop, a dietitian showing families how to read food labels and prepare balanced meals, teaching breastfeeding mothers how to breastfeed, and so on and so forth, as highlighted here. All these are examples of health education. And in all these cases, the focus is just to provide information and teach them skills on changing their health because long explanation enhances knowledge, influences attitudes and belief, and then helps them individuals to develop skills for them to take actions that will positively impact their health. Then practical examples of health promotion. The focus is to create an enabling environment, to create policies and systems that will help people to make those healthy choices in an easier way. For instance, and most times it is governmental bodies that are laws that insist that certain places are no smoking, no smoking sign in some places. That is a form of health promotion. Then a situation where the government bans smoking in certain places like workplaces, restaurants, hotels, and stuff, or hotel owners banning smoking in certain areas. Those are forms of health promotion. Government puts a tax on sugary drinks or on certain um, substances that are considered harmful if taken in excess quantity. That's a form of health promotion. Then if a workplace management, for instance, decide to create a wellness program for their staff, that is a form of health promotion, and so on and so forth, as highlighted here. So all these actions, they go beyond teaching, which is what health education focuses on. They change the environment and they enable the policy to support healthier behaviors. So that's it with regards to the definition and overview on health education and health. Please, if you are still following, can you just indicate so that I can be sure that I'm not talking to myself? Just a thumbs up or a yes will be fine. Okay, thank you very much. Okay, thank you. Okay, so let's go to the goals. Now let's talk about health education proper. Our course material highlights one one goal of health education is to enhance health, have the capacity to process information. So when you're talking to people about and then apply it for themselves is what health literacy is all about. So health education helps to increase this literacy level in individuals, in people. Then that's one of the goals. Number two, it also aims to promote health behaviors, for instance, healthy eating, adequate sleep, physical activity, how to manage stress, avoiding risky behaviors like use of tobacco, substance abuse, and so on. So one of the goals is to promote health behaviors among the people being educated. Then number three, to prevent disease and injury, both through communicable and non-communicable diseases. So communicable diseases like COVID-19, when you educate people that, okay, you have to put on your face mask, you have to wash your hands, you have to prevent, when you're coughing, you have to cough into your elbow and all that, you are teaching them how to prevent disease and injury. Then also teaching them things like safe sex practice, early detection methods, like when you teach women, maybe in a community or in a certain professional workplace, how to examine early signs of breast cancer and all that. That's one of the goals, to prevent disease and to prevent injury. Then number four, to develop self-efficacy. Self-efficacy means that an individual's belief in their capacity to execute behaviors that are necessary to achieve specific outcomes. So when an individual believes that he has the ability to practice what the nurse or the doctor or whoever the health educator is talking to them about, that is one of the goals of health education, to help them to facilitate informed decision making, equipping individuals with critical thinking skills so that they can make informed decisions about their healthcare and lifestyle choices. So that they can make informed decision about their lifestyle choices. So this includes understanding the benefits and risk of different options, weighing potential consequences, and considering personal values and preferences. So one instance I can give in this situation is maybe use of contraceptives. For instance, we have different types of contraceptives, and some people will prefer certain types of contraceptives to other types, maybe based on their religious stance or their cultural beliefs and all that. So it helps you to facilitate um, making decisions in an informed way, like you know what you're about to do, just to facilitate your ability to take decisions. Then it's also one of the value is to advocate for health. So health education, like example, okay. So when individuals are they are equipped to become self, so that they can also insist that, okay, we need to create a law in this community that anybody that is found doing this will be fined 20K for this, or things like that. So people, those are the goals of health education. Now we go to the objectives. Um, Please, if you're following, can I just get your feedback? So far, so good. Not, not. Okay, thank you very much, Kathy. Okay, so let's go to objectives of health education. So I'm sure we must be familiar with the word SMART, SMART, which represents specific, measurable, achievable, relevant, and time bound. So the objectives of health education are statements or SMART statements that help to articulate what the intention of that health education is all about, the objectives. And the four major objectives are basically knowledge, attitude, skills, and behavior. You can use the mnemonic BASK, BASK. I didn't arrange it that way, but it's quite easy to do that now. So knowledge, the objective is to increase people's understanding of specific health topics. So when an educator comes and wants to talk to people about diabetes, even if there are non-diabetic people there that knew nothing about diabetes before, at the end of the day, when the person is done talking, or educating them, they are in their awareness about things, myths about diabetes, like saying taking excess sugar. Taking excess sugar is what will make you come down with diabetes, and all that will be debunked by virtue of that health education. So that's one objective, knowledge. Then attitude, people's attitude um some people used to have funny beliefs about certain things regarding health, but when they are health educated, their attitudes change. So that is an objective of health education. Then the skills, helping people to be equipped with skills that can make them live healthier lives. For instance, saying frying stuff, frying food, always taking foods that are fried and deep fried in oil, not knowing that they are not healthy for you, can make you continue in that line. But once you are health educated, then you are equipped with the skills to say, okay, instead of frying, you can prepare your plantain or your whatever meal in such and such a manner. It is safer for you, and so on and so forth. And same thing with regards to physical activity and accessing health services. Then behavior change. Health education helps to promote the change in the health behavior of people when it comes to their health, improving their health. So now let's talk about the concept of health promotion. So understanding the concept of health promotion, its principles and its strategies involves advocating for enhanced health and well-being for all, delivering health education awareness campaigns, supporting capacity building and the development of personal skills, recognizing the importance of equity, diversity, inclusion, and indigenization, reducing barriers to accessing opportunities and support, and then creating supportive environments to make healthy changes. These are the concepts of health promotion. So health promotion yes, okay, concepts of health promotion. We're talking about health promotion now. So health promotion doesn't just focus on individuals, but is how will I explain it now? Okay, so it involves an interplay of social, economic, environmental, political, and the cultural context in which people live. So when health promotion is at play, it's helps to create a supportive environment to help people to make these healthy changes that we've spoken about under health education. And then it also involves advocacy, enhancing even the health education itself, delivery of such health education, enhancing it, and we're going to see it under the explanation as we go further. Supporting the capacity of individuals and communities to be able to practice healthy changes and healthy change behaviors. And then also understanding that you are dealing with people, different people from diverse cultures, diverse origins. So you need to also put that into consideration when you're talking about health promotion. So there are six principles under health promotion. We have empowerment, participation, holistic approach, equity, intersectoral collaboration, sustainability. Now, I'm just going to touch on them one by one as highlighted in our material. So with regards to empowerment, it involves empowering people to to be able to gain control over their lives and over their health. And this includes building skills and creating opportunities for participation in decision-making processes that affect health. So when you come to a local community, for instance, to educate them about the danger of maybe using well water for drinking without boiling and filtering and all that, you um, health promotion helps to empower people to be able to build skills and opportunities to participate in making decisions, maybe with their leaders, the leaders of such communities, to create better water source options, for the community, considering the fact that they have been health educated on the dangers of diarrhea and other waterborne diseases that could occur if they take maybe water from the stream or water from the well and all that. So they are empowered to be able to take action with regards to getting better sources of water. Then participation. Health promotion emphasizes the active involvement of people to identify needs, their health needs, both their individual health needs and their corporate health needs. So at the end of the day, communities as a whole, they are able to participate or intervene in, how will I put it now? Okay, intervene in health changes in such a way that it doesn't affect their cultural beliefs. So whoever is coming to promote health in that community or in that locality or population, so to speak, the people will readily accept what is the health change being advocated for, and they will even participate in it. So that's one of the principles of health promotion, not just having an external factor coming to promote health, but the people themselves are participating in that health promotion practice. Then there is the principle of holistic approach. So in health promotion, you don't just focus on only the people's physical health. You're also putting into consideration their social health, their mental health, their spiritual health. It is a holistic approach that is encompassed in health promotion. Then interventions aim, okay, that's holistic approach. Then let's talk about equity. I think in one of our discussions, someone talked about the difference between equity and equality or something. So health promotion talks about, principle, one of the principles of health promotion is equity. That is addressing health inequities. So everybody has equal access to health improvements. There is no, okay, because you're from this societal level or this economic level, you're from this status, you're among the rich, you're only the rich people are going to enjoy this health promotion opportunity. Those that are poor are not going to, or vice versa. No, there's equity. Everybody is addressed, the health challenge of everyone as much as possible is addressed so that everybody can achieve optimal health together. Then another principle of health promotion is intersectorial collaboration. So now, in health promotion, we don't just involve only health professionals saying, okay, it's just the health assistants, nurses and doctors and pharmacists and chemists, and just those that are medically inclined that will be involved in healthcare. No, we involve every sector: education sector, housing sector, environmental sector, agricultural sector, and so on, according to World Health Organization 2021. And addressing all these determinants of health requires that every stakeholder in all these sectors come together to collaborate to promote health in that environment or in that community or in that country. Then finally, sustainability. We don't want to just promote health for a short period of time. We want something that can have a long-term impact on the people that are being affected. So that's that about the principles of health promotion. So before we go on, I spoke about the 4 key areas targeted by the objectives of health education. Can we just list them? I think I created a mnemonic for that. The question here says, what are the 4 key areas targeted by the objectives of health education, and how do they contribute to behavior change? So we can just highlight the 4 key areas I said, since we are following the discussion. Yes, behavior, thank you, Steve. Attitude, knowledge. One more. I think there's an S somewhere. Skills. Thank you so much. Thank you, everyone, for the contributions. Okay, thank you. All right, we are following. Thank you so much. Okay, so those are the 4 key areas: knowledge, attitude, skills, and behavior. And that is what we've already broken down that's down so that I won't repeat myself again. Then number two question here says, what are the three key principles of health promotion, and why are they essential for effective interventions? So three key principles of health promotion. I mentioned six. You can mention all six if you remember them all. Ouch. Um, Sustainability, yes, that's one. We just spoke about six. Empowerment, participation, equity, holistic approach. Yes, thank you so much, Charles. Thank you, Favor. Okay, Hawa says equity. Thank you. Yes, equity, empowerment. Okay, intersectoral collaboration. All right, thank you. Okay, so those are the six principles of um of health promotion, and then why they are essential for effective interventions, as explained already. So this is where my jotting stops actually. I couldn't jot beyond this. For me, the time was not adequate, but I was able to read through. So I think I would have to, let's say, focus on my computer screen now so that we can just read from here if we can see. Um, or rather, let me check for the material on my phone. I think it will be better there. It's not clear from the computer screen. Okay. So I'm not sure we'll be able to cover this part A and B tonight under 1 hour, to be honest, because part A alone is voluminous. That was partly why, for me to have been able to cover everything, I'll have to have sleepless nights for the past 3 nights, and that was simply not possible. So I did my best. Okay, so I'm imagining it to be easier for us to follow. Okay, so the next point now, so what we have to discuss now is the strategies of health promotion, and then some exam screen. I forgot. Okay, no problem. Okay. All right, thank you so much. So the next subtopic we're going to be considering is strategies of health promotion. So the Ottawa Charter, which is under the World Health Organization, in 1986 outlined 5 key action areas for health promotion. First, building healthy public policy. Second, developing personal skills. Third, creating supportive environments. Fourth, reorienting health services. And fifth, strengthening community action. So in building healthy public policies, it involves advocating for policies at every level of government that supports health and well-being. For instance, putting a tax on unhealthy products like sugary drinks, tobacco, and alcohol is a form of a strategy to promote health via building healthy public policies. Then developing personal skills like helping people who are health educators, to enhance their programs. Then we have teaching people life skills, that can help them to live better lives. For instance, the skill application of CPR, for instance, when you have someone fainting, maybe in a football field or anywhere at all, teaching them such. So providing people with the skills, the knowledge, and the confidence to be able to take charge of their health. This is almost like health education, but it's more like enhancing health education. So that's a strategy of health promotion. Then number three, creating supportive environments. Now, to create enabling environments that help people to be able to make healthy choices more easily. For instance, when school management says that you must put one fruit in your child's lunch bag when they are coming to school. If not, they'll be sanctioned or something like that, that is a way of creating a supportive environment, and that's a strategy of health promotion. Then number 4, reorienting health services. Now, this includes integrating preventive care into primary health care and then developing partnership between health professionals and the community. So at the end of the day, you don't just have people strolling into the hospital only when they are sick, but also involves the healthcare professional bringing health, addressing the social determinants of health, both within the clinical settings and in the community, because you don't have the health professionals just sitting in there, but they are also interacting with the community as the need arises and as they create opportunities. So then one final strategy is okay, sorry about that. Okay. Then final strategy, strengthening community actions. So it involves helping communities to be able to identify their health needs, prioritize them, and then take action to address them as much as possible. Like when you have maybe an outbreak of cholera in a community, for instance, and instead of just having the people attribute it to maybe one spiritual attack or something, you empower them to be able to identify it as a health need, make it a priority, and then collectively address it as much as possible. So the Ottawa Charter says that there are 3 main ways to help people in Africa to become healthier: to speak up, that's to advocate; to give power, that's to enable; and then to work together, that's to mediate. So speaking up involves using our voices to take action, to change things that make it hard for people to be healthy across Africa. Examples that we have here include advocating for clean water and sanitation policies. Sometimes this can involve lobbying to insist that funding is increased towards building structures that will enhance clean water provision in those communities, because many communities in Africa lack clean, safe drinking water and even toilets, and that leads easily to diseases. So using our voices to speak up and insist that this is what we want, advocacy, is one of the ways to help people in Africa become healthy. And then pushing for regulations on healthy food and drinks. Recently, I attended a webinar, or let's say it's a seminar, that was organized by CAPA, an NGO that advocates for healthy, health-based foods and all that. And the focus of that webinar was on insisting that foods that are high in salt or high in sugar should have it boldly written on the front, not just in tiny letters that like we see on the packs. Sometimes you buy Milo or any beverage or something that may be high in sugar content, and then the content of the sugar and all that is just written in tiny letters, but advocating that these things should be boldly written in front. So and so percentage amounts of sugar. This is high in sugar content, high in salt content, so that people will know that when they are buying this stuff, they are buying something that may not be so healthy for them. So speaking out, that is one way of advocating, for regulations on unhealthy food. Then raising awareness about the impact of climate change on health, how floods are affecting African nations today, how droughts and disease transmissions are being increased should be spoken about, and also awareness should be created for policies to be created to help to curtail all these activities. Then give power means making sure that people in Africa have the information, the is to take charge of their own health and make healthy choices. For instance, community health education programs, going to local communities to talk to them about how to prevent something as simple as malaria, TB, HIV. This can involve training community health workers and conducting outreach and workshops, then promoting women's health and education, and then supporting local food production and nutrition, enhancing our agricultural sector as much as possible to enhance local food production and avoid waste. Food is also a way to give power and enable the people to help people live healthier lives in Africa. Then finally, working together, that is mediation. This means that health is not just the job of doctors and nurses, but should include people in government, in businesses, in communities, in the media sector, and in international organizations. For instance, partnerships to combat HIV/AIDS. So one of the reasons why HIV/AIDS has been successfully reduced as compared to before, when it was on the rise, is because of mediation. People who took it upon themselves to start non-governmental organizations to advocate for free treatment. So we find that in hospitals today, people who are HIV positive have access to free medications, especially in government hospitals, because of these NGOs, because of religious organizations who stood up to mediate in such situations. Then you could working also with mobile phone companies to send messages like short SMS across numbers all over maybe a very large community of people. Partnering with such companies is a powerful way to reach large populations. I'm sure many of us may be some of our numbers. I know one of my lines, I get health tips once in a while on what to do or what not to do with regarding my health. You understand? So partnering with them can also help, is a way to help Africa live healthier lives. Then engaging traditional healers also. Many people in Africa are, as in they prefer going to traditional healers or traditional birth attendants to seek healthcare rather than going to hospitals. So understanding how important they are in the lives of African people is a way of helping us to, to mediate with them. Rather, mediating with them will also help us to live healthier lives in Africa. Then other examples here are media campaigns involving celebrities and influencers, using popular figures to promote healthy behaviors like vaccination, disease prevention, and so on, can be a very powerful way to reach a wide audience because they have, the people who follow them and they can easily listen to them. So I'm on page 10 now, 1.1.4, the differences and similarities between health education and health promotion. So we want to look at the differences now between health education and health promotion. With regards to the focus, from our explanation at the beginning, we already understand that the primary focus for health education is on an individual level and group level behavioral change. Then for health promotion, it covers a broader perspective, addressing all the social determinants of health: social, economic, environmental, political, and cultural. So the primary focus is or foci differ. For health education, is individualized. For health promotion, it involves the well-being of populations, through policy making and so on. Then the scope for both of them, for health education, the primary focus, the scope is on educating individuals or groups or communities to facilitate change in their health behavior within a specific context, while that of health promotion encompasses wider ranges of interventions beyond education, and it involves changes in policies, just like I explained earlier, creating policies that would insist that if you're in a particular place, you have to behave in a particular healthy, health conscious way, then environmental modifications, maybe creating road networks that makes it easier for people to do exercises, for instance, physical activity. If you want people to have increased physical activity like jogging and stuff, and then organizational development, advocacy, social marketing. Then the approach differs for both of them. For health education, it usually relies on communication theories, learning principles, and behavioral change models to facilitate voluntary adoption of healthy behaviors and to empower individuals to make informed decisions, while health promotion is more multisectorial in its approach. Then the target for health education is to individuals, while the target for health promotion is to entire populations. The goal for health education is to enable people to be able to make informed decisions about their health, while the goal for health promotion is to create an enabling environment for this to happen. So despite these differences, they both share several similarities. For instance, their overarching aim, both of them are concerned with improving health. One is improving the health of individuals, the other is in improving the health of populations. So the aim is the same. Then they are both evidence-based in practice. So they both strive to use research and evaluation findings, I believe, from epidemiology to inform, to create strategies that help them to be able to make the changes. So if you are health educating people who have diabetes, that, okay, if the level of your blood sugar requires you to use insulin, and then of course, or rather, let me not even go to insulin. Let's talk about even changing diet, something as basic as that. There are evidence-based research findings that show that improving your lifestyle and diet helps to bring your blood sugar down to a level to the point where you won't even need your medication at some points, So having that information also influences health promotion. So at the end of the day, you are also able to influence populations to take up lifestyle and dietary changes, especially if a majority of them are in diabetic population, something like that. Then emphasis on empowerment. Both of them aim to empower people to take actions to improve their own health through different mechanisms, but it's still the same empowerment. Then ethical consideration. Both of them consider the ethical, fundamental ethical principles like respect for autonomy, beneficence. These terms are terms that we can look up to understand better. I wouldn't want to take more time. It's almost 1 hour already. Then importance of communication. Both of them, of course, emphasize the importance of dissemination information through effective communication channels. So please, if I'm still being heard, could you kindly indicate by a thumbs up or a yes? Please, can you still hear me, everyone? Okay, thank you so much, Steve. All right. Thank you, Cindy. Okay, so now I'm on page 12. Page 12 talks about the scope and importance of both health education and health promotion. Page 13 talks about the importance page 14, ancient period, medieval period, modern period. Okay, so
No,
I don't know.
we don't need to do
Out of
we don't need to do the history part of it.
okay,
Yeah.
because I'm looking at it like we're going to sleep on this call if we continue like this. Okay, so let me just okay, so we'll just cover the scope of um the scope and importance of health education. And yes, the scope and the importance. I think that will be the end of my part A. I don't know if Deborah has joined us yet, but let me just continue. So talking about the scope. Okay, so okay, here it says both health education and health promotion are indispensable components of public health practice, and they both contribute significantly to improving health outcomes and reducing health disparities globally. Okay, so talking about the scope is what it covers, what both health education and health promotion covers. So number one, okay, we have, okay, I'm just trying to see if I could create a mnemonic from this. There's LAME there and the HED. So lame head, LAMEHED covers is what covers the scope. So let me just use my mnemonic that I just formed now, lame head. So L stands for lifestyle modification, A stands for addressing social determinants of health, M stands for mental health and well-being. E stands for environmental health. Then H, health literacy enhancement. E, name hard, sorry, advocacy for health. And D, disease prevention. So I'll just follow my limonic so that but I'm studying as well. I didn't read this part before now, so I'll just use this to remember. So lifestyle modification as part of the scope of health education and health promotion. So lifestyle modification includes promoting healthy lifestyles like um, regular activity, nutritious diet, stress management techniques, avoiding harmful substances, and then health promotion creates the environment that makes it easier to practice these choices. Just like the examples I gave at the beginning, where you maybe, for instance, the avoidance of harmful substances. Now, I want to be able to avoid using tobacco or hard substances because there is a tax on maybe producing these things. Now, I may not have so much easy access to it. So that's how they both collaborate with regards to lifestyle modification. Then A, addressing social determinants of health. On one hand, health education helps us to be aware about the social inequalities in health and provides people with skills to be able to navigate challenging circumstances. Then health promotion addresses the social determinants, social, economic, and political factors that influence health outcomes through policy changes, community empowerment, and advocacy efforts. Okay, maybe a little bit of explanation will be needed for this point. Um, Maybe when we're all unmuted, we can just highlight that. Then mental health and well-being, both of them address the promotion of improved mental health, reducing stress, and how to coping mechanisms, um, coping mechanisms that help us to manage stress. So with health education, you can talk to people about how they can manage stress management principles and practices and all that. Then health promotion helps people to be able to practice what has been taught, by the health educators. Then of course, they also help to reduce stigma so that people who have mental health challenges are not stigmatized by virtue of, maybe what people believe mental health challenge may mean. Then E, environmental health. With health education, you can talk to people about how exposing how the um, environmental risks okay, sorry, health education can inform individuals about environmental risks and then empowers them to take protective actions and advocate for healthier environments. Okay, like I explained earlier, with regards to insisting on maybe having the environment clean. You make people understand the importance of environmental risks and empower them to take protective actions. Then health promotion addresses the determinants of health, like the quality of water in an environment, the quality of the air, the sanitation, and the housing. In maybe creating policies that insist that waste management agencies should always ensure that they do their work at certain times of the month or certain times of the week so as to keep the environment clean. So that's the part that the health promotion parties can play, side by side, the people being health educated. Then H, health literacy enhancement. Sorry that I'm reading it in a scattered manner. I'm just following the mnemonic I just formed. Health literacy enhancement is part of the scope of health education and health promotion. So, enhancing the health literacy is one of the principles of health education. So health education is fundamental to improving health literacy, like it says here. Then health promotion helps to create the enabling environments to help people to improve their health literacy. Then advocacy for health. So there is ability for people to be able to advocate for healthier choices to be made for them at the individual level and at the community level when they are health educated. Then health promotion helps to let's say, okay, it says often takes a more direct and systematic advocacy role, while health education can empower individuals to advocate for their own health needs, yes, and the health of the community. So health promotion takes the part of the advocacy part, and then health education helps people to be able to advocate for their own health needs and that of where they stay. Then finally, disease prevention. Both health education and health promotion play a vital role in preventing diseases, both communicable and non-communicable diseases. How? With health education, people are aware. Awareness is created among the people. People are educated about what these diseases are, what puts you at risk of having this disease. For instance, cervical cancer. What puts you at risk of coming down with cervical cancer? The virus, human papilloma virus, having multiple sexual partners or unprotected sexual intercourse with maybe multiple partners and all that. When you have been health educated, then with health promotion, there is advocacy that health hazards that are related to that can lead to self-cancer, cervical cancer, are reduced by maybe providing, like what some NGOs do, providing condoms and other options for young people to go for, so that they can practice safe sex and all that. So the scope of both of them is disease prevention. Finally, we are talking about the importance of both health education and health promotion. I believe that with everything we've discussed so far, there is no doubt that both health education and health promotion are very important. So, to what end? Number one, improved health outcomes, of course, when people are health educated and the bodies that are supposed to promote health play their own parts, there will definitely be improvements in the health outcomes. The mortality rates in communities will reduce to the barest minimum as much as possible. Infectious diseases will be reduced, premature mortality, injuries will also be reduced. Then there will also be reduction in the healthcare cost. Why? Because now people will now be focusing on preventing diseases rather than waiting to come down with those diseases and finding a way to treat them. So they won't have to spend as much as they would have if they had come down with those diseases. So it helps to reduce healthcare costs. Then, of course, the quality of life will be improved, will be increased. There will be better physical health, mental health, social health will be improved. There will be better social engagement. People will, contribute more, to make their society to thrive. Then advancing health equity. When all the social determinants of health are addressed and people are empowered, to be able to live healthy lives, there will be a reduction in health disparities. Everybody will have um, fair and equal access, to being healthy, to living healthy. So because they are all being health educated and the health promoters are playing their part as well. So it will advance health equity. Then individual and community empowerment. Of course, it goes without saying that people and communities are now empowered to take charge of their health through health education. Then finally, contributing health education and health promotion, sorry. Then finally, it also helps with regards to contribution to sustainable development. With health promotion, there is because there is collaboration now, not just in the health sector, but there's collaboration with the other sectors, the education sector, the agricultural sector, the political sector, and so on. As by virtue of that collaboration, the health outcome will not just be temporary, it will be long term, it will be
Vicky,
sustainable,
please,
and
can we round up so
eventually.
that, hello, can we round up so that we can also take the second part?
Okay, I'm done actually. I'm
Okay.
done. Thank you very much. Thank you.
Um, would you want to ask questions to just know that, okay, we were following? So maybe you can ask us questions. Thank you so much. Thank you.
Okay. Um, okay. That's
Like
fine.
just maybe
Okay.
one or two questions you can
Okay.
just ask to so that maybe two persons can just answer and we'll be sure that people followed. Then we can quickly move on to the second part. You get?
Right. Okay.
Yeah.
Yes, I get. All right. Okay. So can we just highlight the main differences? Can anyone just help us to highlight the main differences between health education and health promotion?
Please, if you want to answer, you can raise your hand, then I would unmute, or you can just mention in the chat box anyone. If anyone wants to answer, just take your hands up, then I will ask you to unmute, okay?
Mhm.
She asked for the difference between health education and health promotion, right?
Yes, yes. Difference
Okay,
between health education and health promotion.
yes. So please, who wants to go for it? It's a discussion, like all of us should actually be talking. And this is the key thing. This is the core thing in what she has taught today. So please, somebody should just help us out. Thank you.
Okay, maybe we. Okay, Steve says health education basically informs, while promotion goes ahead to develop scopes to practicalize what we've learned. Okay, thank you very much. Charlotte says health education is individual or oriented, while health promotion involves the population at large. Okay, thank you. That's with regards to the primary focus. Okay, so Steve covered I believe the approach. Yes, the
Yes,
approach.
there's
Okay.
a hand
So
that
we
is
have this.
raised. I want to ask the person to unmute. I think the person wants to answer too
Mhm.
or something.
Okay.
Okay, so user, you
Okay.
don't have a name. I've asked you to unmute. You can unmute and talk.
Okay, good evening, everybody again.
Good evening.
According to what we're taught just now, health education is about teaching people, teaching people how to take care of themselves and how to manage their health. While on the other hand, health promotion creates environment, policies, and system to help people make healthy choices. And health promotion is usually anchored by maybe a system like that. It goes beyond just teaching people how to manage their health. I'm done.
Thank you very much. Okay, thank you so much. That was really helpful. Victoria. Okay. So thank you so much, Victoria. Please, can we appreciate her in the comment section? I don't think she gets to see the emojis, but she sees the comment section. So please, can we appreciate her? Thank you so much, Victoria. Thank you so, so much for taking your time to walk us through this topic. Thank you so much. Victoria has a partner. She was to take the first part, then Victoria was to take the first part, then her partner was going to take the second one, but her partner is not available this evening. So I just want to quickly just lay a little bit of foundation. I actually did not revise that part B because I was thinking, the her partner was going to take it. But we can just talk about it a little so that when we get back to study, it will be easier for us. Okay. Now, a recap of everything Victoria said for anybody who didn't join online. We have health promotion and health education. That's this course that we're talking about, MPH 8109. And why is it even important for us to be talking about this in public health? It's important because, we have talked about the determinants of health. And, we mentioned the many determinants, the social determinants of health. We talk about the emotional component of it. We talk about I think there's even financial determinants of health, a lot of determinants of health, right? Now, we do not just learn about those determinants to have them as knowledge in our head. We want to be able to influence those determinants so that we can have better health outcomes. So that's why we are even talking about this entire thing. That's why we even have this course, health education and health promotion. We want to be able to influence the determinants that we can influence so that we can improve health outcome. Okay? Now, there's health education, there's health promotion. Health education, like she has explained over this 1 hour, is basically saying that there's a reason for why people behave the way they do. And we are theorizing, we are saying that if we make people to be more health literate, if we improve health literacy, that people know what is good for their health and what is bad for their health, it will help them to make better decisions. It will help them to make informed decisions. So, like the example she gave when she was teaching, when you want to do like diabetes education, health education, right? And then some persons may not even know how to, they may just even think that it is, their the gods of their land that's making them have diabetes. So they don't even know what is happening to them. But by the time you teach a person that this is what is happening, you have a body organ that secretes insulin, but this insulin is no longer being secreted the way it should. So that is why you're not able to, your carbohydrate metabolism is the way you explain it basically to them, not in big terms, the way I'm even doing, in very, very low language, the way they can understand. And then you tell them that these are the things you should do. These are the things you should not do. And this is why you should do this or why you should not do that. By the time a person has this understanding, they'll be able to make informed decisions. They'll be able to say, okay, so this is the reason that they are saying I should walk out. I should walk for 15 minutes or 30 minutes every day. That if I walk for 30 minutes every day, it's going to improve the way my body absorbs glucose. That my body cells will take up glucose better, and it's going to help me manage this condition. You tell the person, okay, you are diabetic, you have to look out for your foot because they are prone to having injuries. Sometimes they may not even know that they have injuries. We have to teach them all of this. So the person knows that, okay, when I come back home every day, I should bring a mirror, put a mirror in front of me, put my leg in front of that mirror, and be sure that, okay, there are no injuries on my foot. The person is able to care for themselves better and for those around them better. So that's the health education. And health education, like she mentioned when she was teaching, it focuses on the individual. We're engaging at the individual level. We're talking to people. While health promotion is the broader aspect of this entire thing. In health promotion, what we are saying is that you can teach a person how to care for themselves, how to do this one, how to do that one. For instance, I just finished talking about get a mirror, look at your foot to be sure you do not have injuries. If you want to mix water, if you want to use hot water, let somebody else mix it for you, because they may put their hands inside hot water and they don't know, because they don't have sensations in those body parts. They wouldn't know that this water is very hot, and they just get injuries. And when they get injuries, their injuries rarely heal, except they take good care of it. Now, I will finish talking all these things that you will say all the heaven and earth that we want to say. What if the person doesn't have money to buy a mirror? Because the financial determinant of health is not there. What if the person doesn't even have money to buy a mirror? What if the person doesn't even have money to buy a glucometer? So that's where we now start talking about health empowerment. Okay? That's where we now start talking about policies that the government have to make it affordable for people to be able to cater for their health. So now it's not the individual we are looking at. What we are saying there now is that you can tell a person, in fact, you can tell a person that this is what to do, this is how to care for your health. If there's no enabling environment for the person to do all of this, then the person is not going to be able to achieve it. So you can see that a person may even know that, I'm sick, or I should go to the doctor. I should go to the hospital or something. If healthcare is not affordable, or if the healthcare facilities, if they are far away from the person is not going to be able to go, even though they know that they should go. So that's the aspect where health empowerment comes in, that we need to create the environment for people to be able to achieve well-being. So that's the difference between the health education and the health empowerment. I hope it is clear to all of us now. And we know, okay, this is why we are even talking about this. Like Dr. Victoria has taken her time to explain all of this to us. Where I will just quickly come in is just to, talk a little bit about the theories. Right. So I said I didn't revise this because it was her partner who was to take it, but we will just do the most that we can do, just so that we have a fair understanding. And when we get back to study, we can build on it. Okay, so I'm sharing my screen. So this was the slide her partner was supposed to use, and that's what we're going to use. We'll just talk about it quickly. So the part B of this session 1, this study session 1 that was taken today, Dr. Victoria has taken the part A. She has walked us through the part A, and the core of that part A is us being able to differentiate between health education and health promotion. And then, she talked about a lot of other things that we can go and read up again to, so that we can own the knowledge. So the part B of this session 1 is talking about, health behavior change. And health behavior, we first of all said that behavior refers to action. Another word for behavior is something somebody is doing repeatedly. It's like an action that is carried out repeatedly, something someone does repeatedly. That's what a behavior is. If you do something once, we can't call it behavior. By the time you do that thing repeatedly, now we can say, this is how the person behaves. So when we say health behavior, it is like a repeated action that people do that affects their health. And it can affect their health either positively or negatively. It is important for us to know this because we are trying to modify behavior. Remember that we've talked about the determinants of health in all the previous sessions that we've had. Some of these determinants of health, they are behavioral components to it. And we are saying that we need to be able to modify people's behavior so that they can change the way they behave towards their health. So we're now going to be learning about different theories. I think they mentioned about 4 theories here. Those theories are telling us what the theories are basically saying. It's saying that, this is explaining that what they're just trying to explain that we think this is why people behave the way they do. That's what the theory is all about. So there are 4 theories, like general theories that say this is how we can explain people's behaviors. And then based on those theories, we can plan how to cause a change in their behaviors. So there's a theory, and then there's something they call models. The theory is just the explanation part of it. The model is now the part where it tries to make it applicable. It tries to make it look more something like, how do we apply this thing? How is this thing? How does it play out in real life? Theory is just concepts being discussed, but the model part of it is, how does it now play out in real life? So that's model, okay? That's why we are going to be learning health behavior, because we want to be able to cause behavioral change. And for us to cause changes, we need to even understand why people behave the way they do towards their health. Okay. So, it mentioned different types of behavior, positive health behaviors and negative health behaviors. So when we're talking about health behaviors, we're not just referring to negative or positive, both of them, when we say health behaviors. So there are positive health behaviors and there are negative health behaviors. And then it says here that health behavior change is the process of replacing. So we should know this definition. When we say health behavior change, what we are doing is replace the negative health behavior with positive health behaviors. To what end? To improve well-being. So let's learn the theories of health behavior change. Let's learn these theories. Now, I said before that I haven't revised this, but we can, just walk around it, explain it, and by the end, anybody who has better understanding can talk to us about it. So that when we get back to read, it's clearer. So the first one here is the theory of social cognitive theory by Albert Bandura. Before this time, before they brought about all of these theories, there were different things that people were saying about health. People were saying it's there's something called reinforcement, that is basically something that if a particular behavior is being encouraged, if it's being reinforced by maybe punishment, if it's being reinforced by reward, or if it is being discouraged by punishment, that's what results in how people behave. So the behaviors that are punished, people are less likely to adopt them. The ones that are rewarded, people are more likely to adopt them. Those are the kind of theories we had before now. Okay, so we now had this guy called Albert Bandura. He talked about the social cognitive theory. Now, when we are learning these theories, we need to learn the constructs the concepts of the theories. They usually have like key concepts or key constructs in these theories. So each of the theories we're going to look at, we should note the key concepts or the key constructs of those theories. So this social cognitive theory, the summary of what he's saying is that people learn by observing others. One, people learn by interacting with their environment. Two, and then personal beliefs. So that's like the baseline of what he's saying here. That the way people learn is when you go outside and you see somebody is running, somebody is jogging. You come again tomorrow, you see another person is jogging. Next tomorrow, you see people are jogging. Small time you see, let me save. Maybe this jogging, there's a good thing to do it. Me save, let me start to jog. You get? So it's saying people learn by observing others. And then people learn by interacting with their environment and then through personal beliefs. So what are the key constructs of this social cognitive theory? Number one is modeling. And modeling is what? Observational learning. Okay, there's already an example here. If a teenager starts to jog after seeing their older sibling exercise every morning, that's observational learning. That's how we learn, just the way children learn. They watch and they start to do. It happens to us too as adults. So that's the first key construct here. The second one is reciprocal determinism. Reciprocal determinism. What reciprocal determinism is saying, it's saying that everything, all of these components, that they influence one another. That's reciprocal determinism. There's a reciprocation. So look at the example here. If you go to the gym, you're already influencing your environment. You go to the gym, that's the environmental part of it. Okay? By the time you go to the gym, you are motivated. You lift weight, you feel motivated. That's the personal aspect of it. You begin to feel motivated. And then by the time you feel motivated, the motivation also, there's also the environmental part of it where, somebody is looking at you and the person is saying, you are trying. It's also part of the motivation. You feel hyped, you feel pumped. Somebody is looking at you and saying, oh, more, I like the way you used to work out. Oh, I like the way you are doing it. It's feedback. So you have influenced that person. The person is looking at you and thinking, oh, I like the way this person is doing this. The person may even tell you that, I like the way you are always, working out. I like the way you take your exercising regularly. It's giving you feedback. You are feeling pumped. Because of that, you are more likely to return the next day. You feel your confidence is there. You are more likely to return. So he's saying there's a reciprocation between all of these factors. The person is carrying out the behavior. By carrying out that behavior, you are influencing your environment because people are watching. And then your environment gives you feedback because people are looking at you and saying, this person, they try you. This person is taking good care of his health. I like the way this person takes their health seriously. The environment is giving you feedback. That feedback, it boosts your confidence. Now, because of it, you are more likely to keep repeating that behavior. Remember, we said we are learning this theory so that we can know how to change people's behavior. It means if we want to change a behavior based on this theory, we would want to do it in such a way that looks at all of these factors. How can we model this behavior? So when you go to a school and you want to now cause behavioral change, you say, we want to do it using the social cognitive theory. So how do we do it? You now say, okay, let's use modeling. Let's use this. Since there's a modeling component of it, how do we do this modeling part? You can say, okay, let the teachers be the one to model these behaviors to their students. Let the teachers be the one to be displaying these behaviors. Or let us teach the older students so that they'll be the ones displaying these behaviors. And then the rest of the school, the younger ones, will catch up. So that's how we now begin to apply these theories to real life situations. Okay? So that's reciprocal determinism. And then there is self-efficacy. That's one of the constructs in this model. And what self-efficacy is saying, it's basically saying that we believe that people have the capacity to change their behavior. And that is what we want to inculcate into them. We want to make them know that you are responsible for your health. Don't leave it to chance. Don't leave it to chance. Don't leave it to what will be Sarah. No, don't leave it to chance. We want to make them know that they are responsible for their health. That is self-efficacy. When you give people that empowerment, when you give them that kind of way of thinking to know that is you are to a good extent. Of course, there are some health conditions that we cannot do anything about. We know that, like we already said it in our previous classes, that a lot of things are multifactorial. So there are some things that no matter what you do, no matter how healthy you try to live, there are some things that may still happen. But what we are doing is the ones that are under our control, let us ensure that we control them. That's self-efficacy. So when you go to that school to now, carry out your health education programs, you want to cause change in their behavior. You want to also, bring in that motivational aspect of it. Bring them to the awareness that to a large extent, they have the power to change their health outcomes. They have the power to change their whatever it is happening to them. So it's part of the construct in this theory. And so the next one is now what outcome expectation. So there should be, okay, so what will happen if this behavior is performed? It's something that we would also try to convey to the people we want to change their behaviors. We want to know that, let them know that this is the outcome. If you keep passing this, if you keep taking this, if you keep taking alcohol, every, you're taking 2 bottles every day, or you're taking this, you're doing this every day, this is where it's going to land you. And if you decide not to take alcohol, you decide to live healthier, this is where it's going to land you. This is what will happen. So they need to know the outcomes, so that when we go to do our health education, we are not just talking and talking and talking and talking. No, part of the things we want to convey is the outcome. They should know what to expect, the outcome of their behaviors. Okay? And then reinforcement. So there are a lot of things here. Those ones we can, look at them later, but we've talked enough about that theory. So there's a question here, or there are questions here. So I'm looking at the charts. Let's just answer these questions. When a person learns by watching others, what is it called? Let's just put it in the chat box. What option is it? Learning by watching others. What is it called? Okay. I see we said B. Observational learning. All right, thank you. I think we'll be able to answer the rest. So let's just move ahead. We don't have so much time. So the next theory is the health belief model. Okay? This theory was developed by social psychologists at the United States Public Health Service. And what was this theory saying? It was explaining that health behavior is based on individual belief. Individual belief. So health belief model, what does this individual believe about the disease, about their susceptibility? So let's talk about it. When we are saying this belief about what? Number one, perceived susceptibility. Does this individual think that they are even at risk of getting this disease? Because there are people that will tell you, I was talking to somebody and there are people that will tell you, I have spiritual protection, like I'm protected, so nothing can happen to me. And not enough it happened to me. If a person has that mindset, it means they will not even take precautions. They will not even care about prevention. If there's a vaccine for something, they may not even want to take it. Why? Because they don't perceive that they are susceptible. They don't believe that they are at risk of getting it. They say, no, I know if you get her. It cannot happen to me. It cannot happen to me. I'm covered by the blood. or anything else, or I get audition or whatever it is. Now that kind of a person, you will now want the person to say, come and take vaccination, vaccinate your children. You think the person will listen to you? No. So do they even believe that they are susceptible? So look at this. I might get diabetes because it runs in my family. A person who thinks like this is being realistic to say it's possible for me to get diabetes because maybe my parents had diabetes, or my older sibling had diabetes. So, and I know that diabetes is genetic. So there's a genetic component to it. So it's likely that I might get diabetes. A person who displays this level of awareness is more likely to seek for ways to prevent it. We say, okay, since I know that I am susceptible, then let me take actions. Am I still being heard? Please, if you can hear me, mention it in the chat box. Okay, thank you. We're going to wrap it up soon. It's just so that it will be easier for us when we are studying. Okay? So if a person thinks, yes, I am susceptible, I can get this disease, then the person is more likely to do things to prevent getting that disease. They are more likely to take action. So when you go to a place, you will now have to gauge their susceptibility. You ask all those questions, where you have the Likert scale, and then you say, I think I can get diabetes. If you strongly agree, strongly disagree, agree, that kind of, the way they ask those kind of questions, the way it runs in the Likert scale, like that the 3-based one or 5-based one. Okay? So the second thing you now want to check is their perceived severity. Do they even think that the disease is severe? Because if a person thinks that, well, my body go clear am, like disease no dey kill African man, how do you start? You have to start by making them understand the severity of that disease. Because if a person tells you that dirty no dey kill African man or disease no dey kill African man, it already shows you the mental space of where the person, it already tells you where the person's awareness level is at. That you have a lot of work to do. So perceived severity. We've already talked about susceptibility. Does the person think they can even get the disease? Number 2, the person may think they can get it, but do they even think it's severe? Then number 3, perceived benefits. The person you now have to find out, what is the person's belief? Do they even think that, okay, maybe exercising can even help me control my blood glucose, or exercising can help me manage high blood pressure? So do they even believe that there's a benefit from taking that action? If they don't see the benefits, they may not do it, because they'll be like, how we run, it just help me. How we exercise and help me? So you need to think about it, or we need to think about it, or be conscious of it when we are going to carry out interventions, when we are going to, do our health education, health talk, or whatever it is. We want to take note of these points, make them understand susceptibility, gauge their susceptibility level, or how their perceived susceptibility rather, gauge their perceived severity of that disease. And when you gauge it, you now know how to improve on it. The benefits, do they think that is even necessary for them to go to the hospital when they are ill? That they stand to gain, that there's anything they stand to gain from it? Then the 4th one is perceived barriers. If a person thinks that, there's a lot of this exercise you are saying, I agree with you, it's good, but there's no gym around my area. I cannot now carry bike and be going to one place because I want to do exercise. I cannot do it, and gym sub is even a lot of money. How will I be paying 15K? How much is my salary? I'll not be paying. So you can already see the perceived barriers. Those are the things that are important to us as health educators. We want to know their perceived barriers, so that we can know how to address them. We can know how to address these barriers. See the example here. Healthy food is expensive. If a person thinks that to chop healthy is a lot of money, you need to have plenty money to eat healthy. You can already see that the person, this is the perceived barrier to, taking action towards eating healthy. So as a health educator, we will now say, okay, so how can we address this? Okay? Then cues to action. Cues to action are like, the little triggers that will eventually make the person decide to say, it's time. Let me do this thing. I've been thinking about this thing since let me get to work. Let me even try it. Let me even try to change this behavior. That's cues to action. It can be a doctor's advice. It can be media campaign. Or it can be that their friend fell ill. Maybe something they were thinking cannot happen to them. They now see their close relative is happening to them. They may say, this thing is real. So those are cues to action. Okay, there's still the self-efficacy component here again. So we've talked about two theories. We've talked about what? The social cognitive model, and we've talked about not theories, sorry, models, because theories are just explanation. Models is how we now apply it. So if you've been following what we've been saying, we've been talking about application. Okay, so the social cognitive model and the health belief model. So I've tried to mention the key construct in each of these models so that we know what we are talking about. Okay, now the third one is, this is already 9:44. The third model here is the trans-theoretical model. This trans-theoretical model is, you can see the way the name is trans-theoretical. It cuts across different models. So it's also known as the stages of change model. And it was developed by James and Carlo. Okay, by Prochaska and Di Clemente. Those are their surnames. So unlike other theories that focus on determinants of behaviors, this one talks about intentional behavior change. It talks about the process, how it happens. So this one is a big difference from the other models we've looked at. This one is saying, how does change happen? That it happens in different stages, There are different stages to it. There's a stage of pre-contemplation. He said there are 5 stages. The first one is pre-contemplation. During this stage, the individual may not even be aware that I even need to change this thing where they live, no be life. The individual may not even be aware yet. Say this cigar where they smoke, where just they smoke like 5 packs every day. Say no be life I they live. Oh. So at the pre-contemplation stage, the individual may not even be aware. So that's one. Or they may be aware, but they are in denial. Or they are still like, well, free me, Joe. I'm not yet ready for all those people's talk. Free me, I'm not yet ready. That's pre-contemplation. They've not gotten there yet, though. They are still in that denial phase, or they are not even aware that what they are doing is nonsense. That is not good. That is dangerous. That's pre-contemplation. Then the second one is now the contemplation. So something would have happened. Maybe they have seen campaigns. Maybe something has happened to a loved one. And then they now start to think that, this thing where they do, so no be life I they live, I need to change. I need to do better. That's now the contemplation phase. So this model is just talking about the process, how it happens. There's now the contemplation phase. Okay? Now we are learning this process so that you will know the phase at the stage that you are meeting people and how to approach them. The people at the pre-contemplation phase, your main goal will be to bring them to awareness that this thing where you they live, no be life. That's your work when you meet people at that phase. Then the contemplation phase is also to do what? At that phase, what you will be doing is what? To provide them with information that, look at the things you should look at the benefits, look at the disadvantage, look at where this thing, look at the pros and look at the cons of what you're doing. That's your own now as a health educator. Okay? Now the preparation phase. So the person has contemplated and contemplated. Now, from all these things you are seeing, one thing we can note is that we can see that behavioral change does not happen overnight. It's not like maybe you go to the community and you tell them that you need to improve on your this chemical, and you expect that tomorrow when you come, whoa, everybody's already doing the things you said. Rara, oh, it's a lie, oh, it's not like that. So that you will not get pissed and say, how many times we even tell these people this thing? No. There's even something I read somewhere that somebody needs to be exposed to a message 7 times, a health message 7 times before they can decide to take action. So you can imagine it. So that you will not be weary. You will not say, these people, they are like they are not even ready to change. No. Think of yourself as a health educator. There are habits that you wanted to change. Was it overnight that we changed those habits? No. So there's a process. And the way we engage with people in this process, it matters. We have to engage them respectfully. The fact that you told the person that this thing is not good and you see the person still doing it, it does not mean that what you said was useless. It means you have sowed a seed. Let me say it in the Christian language way. You have sowed a seed. It will take time for it to germinate. The same way the Bible used to say that faith comes by hearing and hearing the word of God. That's the same way as health educators. The thing we should have at the back of our mind is that change comes by hearing and by hearing. So keep saying it. Keep educating. We will not stop. Okay? So the preparation phase is the next one. And in this phase, the individual has now said that, I need to make a change. I need to make a change in my life. It's time. It's time for me to quit smoking. It's time for me to stop taking alcohol. It's time for me to change. So you as the health educator, when you meet somebody in this phase, what you are now going to do is what? You give them more fire. You give them more power. You enforce their self-efficacy. You say, yes, you can do it. You give them the resources they need to make that change. So where you meet a person determines how you engage the person. Somebody who is in the pre-contemplation phase, you cannot be giving the person more power. Your focus there is to even make them know that this thing where they live, no be life. That's your focus at that phase. Okay? So there's now the preparation and then there's now the action phase. Now, I need us to know something. This thing is not linear. It's not like the person has to go from pre-contemplation straight to contemplation, then to preparation, then to action. Rara, the person can even move back. A person can go from pre-contemplation to contemplation to to preparation and action. And that's why we have something called relapse. People can retrogress. They can start backsliding. Let me use that term. You know, so there are things, for instance, I used to work out, and then you see you're able to work out consistently for like 2 months, and then you see that the 3rd month the person has gone back to where they were. So what I'm trying to say is that it's not a one-way thing. It's not linear. So we need to have that at the back of our mind so that you will not say, no be gadus be this, no be the gadus wey don't stop to dey smoke. I don't come back again. I don't see you now. You don't dey smoke. It should be, you should have a place in your mind to accept it that it is not linear. People can make progress and for some reason they can retrogress. So that you will not be pissed or disgusted at them. No, remember that we engage people respectfully. Respectfully. So when you meet a person who has taken action before and you see that the person is having relapse, you have to bring them back. You have to pull them, you have to start talking again. You have to start educating again. Then there's now the maintenance phase. The maintenance phase is, the person has done that thing, has been able to The person has been able to sustain the behavior. So the person did it once, but now they are now able to sustain it. Sometimes when I'm on Twitter, I see people say things like, I used to have this behavior, but it's 6 months now, no, or maybe it's for 3 months now, I have not engaged in this behavior. And you see people telling them, yes, well done, well done. So that's maintenance phase. If you meet people at this phase, what we are going to be doing is ensure that we give them the support to, keep doing it. Now, by support to keep doing it, it is different for the different health behaviors that we are targeting to change. Okay, so that's the third model. Then the fourth one is theory of planned behavior. This theory of planned behavior was developed by Ajzen, or whatever, I don't know how to pronounce that. And the key thing in this one is intention. Intention. Theory of planned behavior. The key word here is what? Intention. There is somebody that has the intention, that is intentional, somebody that has come to the point where they now have the intention to carry out a behavior. They are the ones who will carry out that particular behavior. They're the ones that will change it. And it's saying that intention is influenced by different things. It's influenced by attitude. It's influenced by social pressure. It's influenced by perceived control over the behavior. Okay? So attitude. If a person has a good attitude towards a particular behavior, if they think, it's a cool thing, or this exercising, it's a very cool thing, I like it. If they have a good attitude towards it, they would want to engage in it. Then the other one is what? Social pressure or subjective norms. If they see that the society around them is in support of a particular behavior, they would want to engage in it. But if they see that the society around them is not really in support of it, maybe, substance abuse, that the society looks at them somehow, it will discourage some people to say, no, let me not engage in this thing. So subjective norms. Now, if you are a health educator and you want to implement this kind of this thing, it means when you go to a place, one of the things you want to do is to make a certain behavior to be what? Acceptable to the people. You introduce it to, this thing they talk about, influencers. And, try to make it look cool so that it's like everybody is doing this thing. It's a cool thing to do. Let me do it. So social pressure. Social pressure is not only, when you hear peer pressure or social pressure, it's not only for bad things. We can maximize it to bring about positive results. Say, you're not reading your book and you're a student. That's not good though. That's pressure, but positive one. Okay? Now, the other one is perceived behavioral control. It's also similar to self-efficacy in a way. Does the person think it's easy or difficult for them to engage a particular behavior? All right, so this is where we end it this evening. And I guess we have learned enough to help us when we get back to study. Okay? We won't be able to take any questions though. But if you have any contributions to make, okay, we may take a few questions. If you have anything to say, you are free to say it. We have like 4 more minutes. Let me ask everybody to unmute. I think we're free now. You can unmute your mic and say anything you want to say. We have 4 minutes to the end. It's not a slide, really. It's the material. It's the course material. It's not a slide. It was just copied out of the course material. You can unmute yourself and talk if you want to. Somebody wants to add something, somebody wants to say something or ask us a question. Okay, in the absence of that, thank you everybody for being present this evening. Once again, thank you, Dr. Victoria. Thank you so much. Thank you. So tomorrow we are going to meet again. This meeting is going to be daily. So tomorrow we are going to meet again. Please, if it is your turn to anchor, please ensure that, like I said earlier, find a way to write out the key things. We will not be displaying the study materials of MIVA, because we said that it infringes on their copyright. So just copy out the key points, okay? You actually don't need to explain everything inside the material, just the key point, the things you know that these things are salient points that everybody needs to know. Copy them out and then place them in a document. When is your time, you share your screen and you talk to us about them, and prepare questions for us so that it can be interactive. Okay, I like the way we are going. I think we are trying so far. This is our second session. We are really, really trying. The first session, Adisa took us on that. This second section, Victoria took us on it. We are doing very well. So tomorrow we are still going to meet for another study session. Okay, like this, we're going to cover this entire thing, and we have good understanding of what's happening. So thank you, everybody. If there's no question, we are going to call it a day. Good night, everyone.